I have verified orders, completed hand hygiene, checked the identification bracelet on the baby, and have the baby in a safe and warm environment. I'm going to place the baby on its back and note for flexion and extension of the hips, knees, and elbows. I'm going to also note the body symmetry. I'm going to start by listening with the heart with the apical pulse, and I'm going to listen for a minute, and the normal heart rate should be 120 to 160. After completing that, I'm going to assess the breathing. I'm going to look at the chest and abdomen and see how they move together. The abdomen can move more than the chest, that is normal. Then I'm going to assess the breath sounds. I'm going to compare them from side to side, each for a minute. Normal breath sounds are 30 to 60. And then I'm going to listen to the vowel sounds in all 4 quadrants. All right, and now I'm going to assess the mucous membranes, looking for the color in the lips. Should be pink, and acrocytosis is normal within the first 24 hours, so I would note that if it's there. Then I will assess the skin as a whole. Term infants should have soft and smooth skin with some cracks. Some blood vessels may be visible but faintly. I will then test the turgor on the baby by pinching skin on the abdomen and allowing it to return. It should return quickly. An abnormal finding on the skin would be jaundice, and I would want to note that in the chart. Next, I'm going to do the measurements of the baby. I'm going to take off his hat. I'm going to start by measuring the head right above the eyebrows to the top of the pin of the ear and around. I would note that in my chart. Then I'm going to measure the chest from the top of the nipple around. And then the length from the top of the head to the heel, and I'm going to make sure that the leg is fully extended for the length. And I'm going to note those all in my chart. Next, I'm going to assess the baby's fontanelles. So I'm going to lift it up while supporting the head with one hand, and I'm going to palpate with my index finger softly but firmly along the fontanelles of the head. I would also note any swelling at this time. And the hair texture, it should be fine and silky. Also going to look for any birth trauma to the head or the neck. And then facial symmetry while the baby is crying. I'm going to check for placement of the eyes. It should be, the inner canthus should be aligned with the top of the pin of the ears. Going to shine the light to look at the pupil reflexes in the baby's eyes. If the baby's eyes are closed, I would open them slightly. Then I'm gonna look at the ears at the recoiling. So I would take one side, pull the ear in, see how fast it recoils. I would do that on both sides and compare them. The pinna should be well curved in a full-term baby. Then for the hearing evaluation, I'm gonna clap and observe how the baby responds. They should blink and be startled. Next, for the nose, I'm gonna look for symmetry and nasal patency by occluding one nostril and making sure that the mouth is closed. I'm gonna do it for the other side. And then for the mouth, I'm gonna stroke the side of the cheek, and the baby will open its mouth and turn to that stimuli. Stick my finger in the baby's mouth and assess the gums, the hard and soft palate, and note the sucking reflex that the baby does while I do this. And then when and if the baby is crying, I'm going to look at the oral cavity, the uvula for alignment, and note that if there are episteme pearls, they are normal on the hard palate. Then I'm going to palpate the neck, look at the creases in the folds, note if there's any masses, any swollen glands, turn the neck from side to side. And then I'm going to move down to the chest, start with the clavicle, noting the integrity of the clavicle, and then now looking at the breast of the baby. I've got the areola, measuring it. Once again, it should be 5 to 10 millimeters of a tissue bud. And then for the abdomen, it should have a round appearance. And I'm gonna check the umbilical cord for 2 arteries and 1 vein. The arteries are going to be smaller and the vein is going to be larger. Then I'm going to palpate the belly, moving, starting at the left lower quadrant and moving clockwise. I'm going to palpate lightly. And I'm going to go a little bit deeper, noting any abnormalities, the liver border. Then I'm going to feel for the pulses. I'm going to feel for the femoral pulse, both legs. Then I'm going to feel for the brachial pulse. They should be the same. Then for the genital area, I'm going to check and make sure for uncircumcised patients, the foreskin adheres to the glands and it might be difficult to determine the location of the urinary meatus. The scrotum should be dark pink in Caucasians and deep brown in darker skinned babies. I am going to look at where the scrotum is, the testes, and palpate them. This is the male. And then for the female, I am going to look at the external genitalia first, and then expect the labia majora to cover the labia minora and clitoris. Now I'm going to assess the hips and evaluate the knees by putting them at an equal length and seeing how they fall. If the knees are equal, we're good, but if they're unequal, that could lead to the suspicion of a dislocated hip. Then I'm going to turn the baby over and look for symmetry of the scapula. And stork bites are a normal thing found on the back of the neck, the nape of the neck. I'm going to palpate down the spine, noting the presence of all the vertebrae. And if there's tuffing at the hair at the bottom, I would report that. I'm going to look at the gluteal fold in the buttocks for symmetry. And while I'm on the back again, I'm going to assess the lungs. Again, doing it side to side. And then I'm going to look for the trunk curvature reflex. So I'm going to place my hand under the baby's abdomen, pick it up and allowing the baby to hang. Then I'm going to hold the baby up. And I'm going to put the bottom of the baby's foot in contact with the hard surface. And one foot should extend while the other one flexes like a walking motion. I'm going to then lay the baby back down. Now I'm going to assess the extremities of the body, feeling for the presence of the bones, if there's any dislocations, all the extremities, looking for range of motion. I'm going to check the palmar grasp by putting my finger in the baby's hands, looking at the fingers, counting the fingers. Do the same thing down here on the legs. And then I would do the, notice the creases on the bottom of the foot and look how the baby, by stroking the baby's foot, I'm going to do the Babinski reflex. And then now that I finished, I'd put the hat back on the baby and leave him in a safe position and document my findings.